All right, let's go over how to put in an NG tube. It's terrible. So what you want to do is make sure that you have the physician's order. Look for any contraindications first. Do they just have nasal surgery? Do they have a deviated symptom? Anything like that. Then you're going to go into your patient's room, double check name, date of birth, allergies, perform hand hygiene, provide privacy. You want to inform your patient what you're going to do. So, as I said, NG tubes are not comfortable. They're not fun for the nurse or for the patient. So, just kind of give them as much a heads up and all the education you can so that they know what to expect and they're on board. You want to assess their level of consciousness, see if they're going to be combative, if they are going to be a candidate for this. Pick which nair you want to use. So it's nice to just have a plan. You want to double check which one is bigger, which one they breathe better out of, if they have a preference. And then you also want to double check their GI sounds. You want to do kind of a focused assessment just on that whole system. Like I said, explain the entire procedure to the patient, answer any questions that they may have. They may wonder why they're getting this, and the reason may be to expire contents if there's a blockage or an obstruction. It may be for a feeding tube, so those are kind of different, but both require the same equipment. So you are going to get all of your stuff ready. You may need to clean the patient's face. We'll be attaching tape to their nose, so make sure you use like a cotton swab or alcohol, whatever, to clean it off really good. If they're oily, if they're sweaty, it's not going to stick well. So we need that tube to stay in. Once it's in, you don't want it to come out for any reason. So make sure that it is secure. Next, you want to make sure you have all of your equipment. So if you need extra assistance, you can plan for that. You need your NG tube, you need lubricant, pen light, you need a marker so that you can mark your tubing where you're going to measure it. You need some towels, an emesis bin, a 60 ml syringe, some tape, a cup of water with a straw so that they can sip and they can help to swallow that tube down, and any suction equipment, and of course your stethoscope so you can listen. Then you're going to kind of prep whatever you can. So get your lubricant out. You could even get your tube set in it. Get your tape pieces ready, as many as you'll need. If you have them set on your tables, make sure your table's clean. Then you're going to get your patient ready. So go ahead and sit them up. You've already told them what's going to happen. And you are going to get them in the high Fowler's position. You're going to put down the side rail, make sure you're at a good working height. And then you are going to let them blow their nose or, take one last sip of water or something, whatever they need. Get them ready. And then you're going to mark your tube. So you want to measure them first. You're going to take the tip of your NG tube, place it at the tip of their nose. You're going to hold it there or stretch it back to the back of the ear. Hold that there. Then you're going to grab this tube and you're going to measure it all the way down to in between their sternum and their belly button. So that's about how far you want it to go down. Make a mark at this point. This is where you're going to use your marker and you're going to mark. That's going to tell you how far to insert this tube once we actually get it going. So you've got your equipment already on the chest. You've measured your tube. It's already been, backtrack. Don't put your tube in the lubricant before you measure because you're going to get it everywhere. So measure first, then you would have put it into the lubricant. So everything's ready. You're measured. You lubricate the end of your NG tube, and now you can go for the nostril. Have your patient kind of bear down, take a deep breath. This is not comfortable. Let them know you're going to do it as fast as you can, but gently and efficiently. So you're going to stick it into the nostril. You can help to twist it and rotate it as you advance it. And then as it goes down and they may start to gag, or you'll be able to tell when it starts going past the nasopharynx and down. You may want to double check with your pen light. So have them open, use that pen light, make sure you can see the tube down in their throat, and then have them sip some water. The more that they can swallow and help push that tube down, the easier it is, the faster it goes. So Have them take little sips of water. They don't want to chug that and run out. So little sips of water, keep pushing it in. At this point, they can put their head down, and that can help. And then you want to look out for any signs that you've put it into the wrong spot. So if your tube went into the lungs, the patient is going to cough. They may not be able to speak or may have trouble breathing. It may appear cyanotic, so look out for that stuff. That is the biggest concern when putting in an NG tube, is accidentally putting it into the lungs and not into the stomach. So look for that. So long as nothing is coming up, you can keep advancing, and you're just going to keep pushing it in until you see that mark that you made on your tube right at the opening of the nair. So that's when you know you can stop. You may want to attach your tape now just so that it doesn't fall out. You don't want this to come out. You don't want to do it again if you're in the right spot. So you may want to attach it. Next, you want to take your syringe and you want to aspirate any fluid, any gastric fluid. So you're going to pull some of that out so we can double check the pH. You may have a cup ready that you put that into to check your pH. And then you want to insert a bolus of air while you're listening. So go ahead and put your stethoscope on, place it below the xiphoid process, and then you're going to listen for that air to go in. So this is a way for us to double check that we've put the NG tube in the right spot. However, it's not guaranteed, so you still need an x-ray. That is the gold standard to make sure that you're not in the lungs. If this patient is here for a feeding and that tube is in the lungs and we start pumping food into their lungs, that's not going to be good. So we need an x-ray to make sure that that tube went into the stomach where it needed to go. So then you just want to educate the patient pretty much. So let them know not to pull on it. You've got it taped on their nose. You also want to maybe attach the tube to their gown. You can have like a little clip sometimes. Don't puncture the tube at all, but sometimes you need to use tape. But you want to make sure that it's secure to their gown, and make sure it's secure to their nose, and then give them lots of education as to how to keep it in there and kind of what to expect with it. That is an NG tube.